All right, I think everyone is back now, so I hope you all enjoyed that and are ready to go ahead and start with our GHU.
Okay. Oh. Okay, so just a quick little intro into what is mental health. So according to the World Health Organization, mental health is a state of well-being in which every individual realizes their own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to their community. So some factors which may affect this mostly are biological. So you may have like a genetic history, especially within your family, or you could have an imbalance within your neurochemistry. Another thing that may cause this may be traumatic events. So things like abuse or something that really messed with your emotions might really, really affect your mental health. And lastly, your social support system or lack thereof. So if you don't really have like a community which you feel can pack you up and support you fully, then your mental health may be affected by that. And then some ways that we see this in our daily lives, our thinking, emotional regulation, and our actions are really primarily driven by our mental health, as well as our social skills and relations to others. This really is the main way in which we can see ourselves in the world. Like the way we think of ourselves is usually like kind of superimposed on the rest of the world. So it's really important that you have a very good self-image and that you are able to deal with your issues in a productive and healthy way as well. Also, just like as an FYI, I know a lot of people get mental health and like mental illness confused and they kind of use them interchangeably. So according to the CDC, mental illness is a variety of conditions which affect a person's thinking, feelings, mood, or behaviors. So this can be manifested in like depression, anxiety, bipolar disorder, schizophrenia, and of course, it's not an extensive list. That's just a few of the most common ones. Okay, and then a major part about mental health is the stigma against it. Unfortunately, like many other forms of bigotry, the root cause of it is otherization. So the way society views people who struggle with their mental health is that people who have problems engaging with their mental health or otherwise controlling it are seen as too different from the rest of society. And this is really perpetuated by like fear mongering and offensive stereotypes. So back in like ancient times, like way back, people used to think that people who struggle with their mental health were cursed, they were possessed by demons, they were enduring the wrath of the gods. Basically like the main point of that was that if you did not have good mental health, you weren't really seen as like human or really being included in society. You were seen as like the ultimate other, like you could not even be participant with everybody else. And then some ways that this is like now seen in modern times is that people think that, you're just lazy, you're lying about it, you're trying to seek attention. People really associate it with like violence, like a loss of wits, which basically means like, oh, like they're not smart, they can barely like do anything in society to be productive. It's also really associated with criminal activity. And of course, disability is always seen as something not to be desired within society or seen as not as human within society. And ultimately, this all culminates in seeing as somebody who does struggle with this as kind of the ultimate form of evil, which is really tragic, And so because of all of this, which is kind of superimposed by society, we see that a lot of people have this internalized stigma against themselves that we don't really see with people who have been injured in like a more physiological way, like a broken arm. So, they feel really embarrassed. They feel very ashamed of themselves. They don't think that they're worthy of being a participant in society. And this leads to a really like lack of self-confidence and a very bad self-image. And because of this stigma, mostly, they don't want to discuss their mental health, and that leads to them not asking for help or seeking treatment. So this therefore then leads them down a path towards both mental and possibly even physical illnesses, which is very unfortunate. And of course, a big part of the reason behind this is a lack of education and access to better health services, which includes therapy. Sorry. And a big part of that is due to poverty. Many people simply cannot afford to invest in themselves. And that's just the sad truth of it. So, and because of this poverty cycle, they can't find employment, they can't find decent housing, and they don't have a really good quality of life. They aren't socially included, and it's just really just one big cycle of poverty over and over and over again.
So, social isolation and loneliness is something that has affected a lot of people, especially during the pandemic. And some signs that it may be affecting your well being are disrupted sleep patterns, social withdrawal, difficulty focusing, or high excitability, especially when taking online classes. So, loneliness is often described as a state of being without any company or in isolation from others, either a community, society, friends, or family. The virtual connectedness that social media has given us throughout the years is most likely what has been causing us to forget what real relationships and what being close to others is. And social isolation has detrimental effects on the mental illnesses and mental well-being, and especially for people that suffer from depression, anxiety, um, other types of medical health issues. And so, I'm sorry, mental health issues. A risk factor for many mental disorders, as I just mentioned, and it is considered a dark and miserable feeling because you don't have, even though you can be surrounded by a lot of people, you are really alone because most of the time, especially during the pandemic, we only interact by video cameras and we don't actually experience that face to face or touch experience that most human beings are used to. So the effects of social isolation, they can also affect your physical health, such as sensory loss, connective tissue, autoimmune disorders, cardiovascular disorders, and obesity. And if prolonged, chronic loneliness may decrease the physical activity, leading to an increased frailty and even fractures. And it can also lead to frustrations because a lot of people, by not being able to interact with others, they want to take it out on authorities and of people that have been trying to, like, for example, keep this pandemic as, safe as possible. And they want to define quarantine restrictions or even cause dire public health consequences. So, social disparities in times of COVID. There is an increasing evidence that racial and ethnic minority groups are being disproportionately represented and affected by the COVID-19 pandemic. These inequalities in social determinants of health, such as poverty and healthcare access, are affecting the groups and are interrelated and influence a wide range of health and quality of life outcomes. The percentage of these cases are higher in the percent of the populations within the US, sorry, my bad. The percentage of the people that are affected by the COVID-19 pandemic are higher than the actual populations of those communities within the US. So now we can see a little statistics of how the distribution of all the race and ethnicities are in the US and how many of the people have died from the pandemic. And as you can see, the highest are white non-Hispanics, but there's also an increasingly large amount of Hispanic and Latino community as well as Black non-Hispanic community. And some contributing factors for the increasing risk of getting sick are discrimination, healthcare access, occupation, because a lot of people are put at risk by their forced or necessary work, and educational income and wealth gaps, and also housing. And these factors, they have been proven that they do promote even more detrimental effects on mental well-being.
So to combine everything that Irene just talked about, I was looking at this article called The Implications of COVID-19 for Mental Health and Substance Abuse, which looked at different categories of the population and saw, what their situation was before the pandemic regarding anxiety, depressive disorders, and substance abuse, and saw what their situation is during the pandemic. And it focused on populations that were particularly at risk for experiencing negative mental health and substance abuse consequences. So just to put things in perspective real quick, before 2020 and before the pandemic, 1 in 10 cases were reported of anxiety and depressive disorder just within the population. And then during the pandemic, another survey was taken in which 1 in 5 US adults reported being diagnosed with those disorders. Another population that was looked at was young adults, and this was especially of interest just because young adults are already at risk for substance abuse and anxiety and depressive disorders. So they were looking at this, and the survey, the data was taken from the US Census Bureau Household Pulse Survey, and 56% of the young adults experienced or reported cases of anxiety and depressive disorders. And this can be compared to the 25% of adults that actually reported it, which is a huge increase. And then another survey in June reported that 25% of young adults started using substance abuse during the pandemic. And before the pandemic, it was down to 13%, which isn't like the greatest, but still it is a serious increase that we can see during the pandemic, and that has ties back towards being caused by the pandemic, essentially. Another community that was, or section that was looked at, was communities of color. They compared, the relationship between mental health and COVID-19 and death rates, and the relationship was proportional in these communities. And then also another big thing that was looked at was essential workers. And when they compared these numbers to the non-essential workers, 42% of the essential workers reported having symptoms of anxiety and or depressive disorders that started during the pandemic, compared to non-essential workers, which was 12% less, and which obviously it's a pretty big gap. And then also 25% of them started using substance abuse versus the 11% of non-essential workers that started using substance abuse during the pandemic, which clearly goes to show that the stressors of the pandemic and everything that came along with it had a big impact on the essential workers. And then they also looked at healthcare workers and reported that 65% of the households that had healthcare workers in their families saw an increase of situations in which stress, worry, anxiety, depression, all of that started up again in their household, and negatively impacted the household. So these are just some numbers that put into perspective, like we hear all the time that the pandemic has negatively affected us, but these numbers really put into perspective, how have they affected us and which groups particularly have they affected.
So making things a little bit more personal now and a little closer to home, we want to talk a little bit about the specific challenges of being a student while in a pandemic, and specifically some of the mental health challenges that come with trying to learn and attend university full-time in such an unprecedented situation. So one of the things that we looked at was the lack of in-person interaction affecting how people learn. So a lot of research is coming out recently that is showing that students learn best from observational learning, where they can work with their peers and with their professors to gain a better understanding of the material that they're tackling. And also group work is a great way of better presenting material and better absorbing material. Now that we're all working, now that we're all learning from home or working over Zoom, it's much more difficult to do this. School has become much more individual, and it's much more difficult to establish proper collaborative teaching techniques. Additionally, uncertainty about the future can be a major cause of concern for students. There's a lot of stress around graduating around this time. If you're not sure if you're going to be able to find a job, it might be pushing you into taking on a master's degree or further education, which you may not have done under other circumstances. Additionally, just the added stress of not knowing about the safety of your friends or family makes it very difficult to focus on something like school when you could be possibly doing more, perhaps by helping out your family, by helping out your friends, and that just does not create an environment that's very conducive to learning, or a mental state that's very conducive to learning. Speaking more specifically to challenging environments, the home office that many of us find ourselves in was not designed to be an education space. Home is not your school or your workplace. This can be seen in a lot of a lack of technological setup for a lot of people. People may not have access to high-speed internet, they may not have access to laptops with webcams, or the technology needed to submit or complete assignments that are due online or digitally. There's also the fact that this constant monotony of always being in the same room, always being in the same place, can make it very difficult to focus on the task at hand. The constant change of walking around a college campus, of being exposed to new people, interacting with new professors, can do a lot to change your mindset and make it more easy for you to absorb information and make it you a more effective learner. Being stuck behind the same desk, being stuck at the same computer for 6 to 8 hours a day really puts you in a rut and makes it much more difficult for you to effectively engage with your classes. Additionally, now that there is no longer a barrier between where we go when we learn and where we sleep, live, and eat, the distractions are much more ready. It's much easier to be on your phone. It's much easier to be playing with your pets, talking to your family, when previously, if you had been in a lecture hall, those immediate distractions were removed from your environment. That just makes it more difficult to focus on your classes. It also makes it more difficult to manage your time. There's now suddenly a lack of a distinction between time that's clearly set aside for school and time that's clearly set aside for your personal life. These things can start to bleed into each other, and especially with everyone, theoretically now at least, being always available, it's easy for people to intrude on what would have been personal time in the past, setting meetings later in the day, or asking for things on shorter deadlines, expecting you to be available on weekends, which normally would not have been acceptable under previous circumstances. We'll talk a little bit more about Zoom fatigue later on. I'm sure this is something that people have heard about now. Like I mentioned earlier, sitting behind a screen for 8 hours a day is not the best way to engage with your classes and with your friends, and that's having a lot of health effects that Anish will touch on a little bit later. And then finally, course design. While we as students are having a very difficult time, professors and administrators have also had to adapt. It is not something that anybody was really well prepared for. So there were some courses that handled the transition to online learning well. There were plenty of others that didn't. Speaking specifically to UC, there was a transition from Blackboard to Canvas, which some professors had a lot of trouble with. And working with a class that you can see has not been very well designed for online learning, it's clear sometimes that you and the professor are both just trying to figure things out. Hopefully things are better this semester, but that is an issue that a lot of students have faced during this time at all levels of education.